Hi, Todd Martin here with The Walking Code. In this video, I'm going to describe my top 5 list of most common walking mistakes. There are a lot of people out there that walk in a manner that is unhealthy, meaning that it is causing extra stress and impact on the joints, which can lead to a variety of types of pain, whether in the feet, the ankles, the knees, the hips, and in the back. These sorts of problems are really common and often are related to faulty walking technique. Sometimes they're related to real injuries, but more often than not, people who develop chronic pain, it is related to a functional problem with the way they're moving and not generally some type of prior injury. So you might ask, if walking is so natural, why do a lot of people have problems doing it correctly? Well, the answer is, think about it this way. Your body is not as simple as, let's say, a car. In a car, when you're driving, you only have a couple of different options for movement. You're going to move forward or backwards, and then you're going to move in the horizontal plane, either turning to the left or turning to the right. So it's very simple. But the human body is more complex than that. We move more like a plane. We can move in a variety of different directions. We can move forward and back, just like the car. We can turn in the horizontal plane, just like the car, but we can also pitch forward and back in the sagittal plane, and we can also tilt in the coronal plane. We have so many ways of moving because human beings are faced with a variety of different types of environments. We're not walking down a straight road all the time. We may be walking on a flat ground. We may be walking on rough ground. We may be walking uphill or downhill, upstairs, downstairs, all manner of different terrain that require us to have a very versatile repertoire of movements that we can do. This presents us with the need to have more than just one steering wheel like a car has. We actually have 3 different steering wheels. Because we have 3 different steering wheels, we have a lot of options for movement, but that also presents a lot of options for incorrect movement. Now, most people don't have a problem moving in the sense of getting where they want to go, but to move optimally, that requires that we get where we want to go efficiently. We get where we want to go with minimal impact on our joints, and we also need to get where we need to go with proper alignment of the spine at all times and proper alignment of our joints and our lower body at all times. That's what will create optimal movement. And because we have so many different options, optimal movement sometimes does not happen. That's why I'm going to present to you my top 5 walking mistakes so you can see if you might be making one of these that puts yourself at risk for eventual pain. And I'm also going to describe how you can correct them by understanding what's causing them. Before we get started, go ahead and click the like button. That will help share my content with other people, and subscribe to the channel and click on the bell to get notifications for my future videos so you can see all my content when it comes out. The first walking mistake I'm going to describe is overstriding. When we overstride, we're taking very long steps, and at the end of the step, we are landing very hard directly on the heel, which is going to cause extra stress going from the foot up through the knee to the hip joint and into the back. This can cause problems when we move. Most frequently, people will be doing this when they're trying to walk very fast. In order to correct overstriding, we have to understand what is happening. When we overstride, what we are doing is we are pushing off with our standing leg hip meaning pushing the standing leg hip backwards, while at the same time we are flexing the swing leg hip. And so we have a combination of two different hip energies going at the same time. Pushing with my left leg in this case, and lifting with my right leg in this case. When you do this, you're going to see a more dramatic forward and backward arm swing, and you're going to see a very long stride, and the stride is going to end when the heel hits the ground. What that means is the heel is hitting the ground at the point of maximal force of the rear leg pushing back. So I'm landing there with a sharp strike on the heel, and that is what's going to send impact up through the rest of the body. How do we correct this? We correct this by only using one hip at a time when we are moving. One hip is going to be active, the other hip is going to be passive. So when we walk with a normal stride, what we are doing is lifting from our standing leg hip, and we're letting our rear leg hip move passively. The forward motion, or a lot of the forward swing of the rear leg, is not because I'm reaching up with the rear leg. It's because I'm using my core to rotate the pelvis. The rotation of the pelvis is what's bringing the leg around, and the rotation of my upper part of the core is what's keeping my body straight as I do that. I mentioned we have three different steering wheels. We have our upper core, we have our lower core, and then we have our hips. All three of these are acting as steering wheels when we move, and we have to coordinate them correctly in order to move correctly. So when I am stepping forward normally, I'm using my standing leg hip to power that movement. And so I'm moving with a nice medium length stride. And you'll notice at the end of the stride, my foot is actually in the air when the stride completes. Only after that forward motion is completed do I then bring the foot down onto the heel in a gentle and relaxed fashion. That is very different than that movement there. When you do it correctly, you're going to land with very little impact and no significant forces going up to damage the rest of the joints in the body. The next walking mistake I'm going to describe is the forward lean. This means when we're walking, instead of being completely vertical, like this, we walk pitched forward. When we walk pitched forward like that, as you can see, similar to the overstriding, we're going to be landing on the heel at the point of maximal impulse off the rear leg. What is causing the forward lean? The forward lean is being caused by improper use of the upper core portion of your steering wheel. We're supposed to rotate like this when we walk and when we do any other movements. So I can either turn my right upper core to the left or my left upper core to the right. This is why our arms are swinging counter to our legs when we're walking. When I'm walking forward, swinging the right leg, my left upper core is going forward. That's why my left arm is going forward. Then I'm going to bring the heel down by changing the rotation to my right upper core going forward, and then my right heel is going to touch the ground and my right arm is going to start swinging forward. So I'm constantly rotating. If you practice this stepping like in place, you can feel, if you exaggerate the motion, the rotation from one side to the next side during each step. It's that rotation that is helping bring the foot down naturally and continuing that forward progression naturally. What happens when we lean forward is instead of rotating where one side goes forward as the other side releases, we end up going forward on both sides at the same time. When you go forward with both sides at the same time, you end up amplifying the forward flexion component of this upper abdominal muscle motion, which is what we would normally do if we were doing a sit-up. So we do that on both sides, and that causes the body to pitch forward. You can correct this by not turning forward on both sides at the same time. Turn forward only on one side at a time, and you're going to be able to control your movement in a vertical posture. Rotation, rotation, rotation. That's how you're going to move vertically without pitching over. Now, the second part of the forward lean, I'm going to label part 2B, or mistake 2B, is going to be the compensated forward lean. This you're going to see more often than the forward lean. Sometimes when people walk uphill, you're going to see the forward lean a lot. You're also going to see the forward lean in older people. Most younger people probably have enough core awareness to realize that that forward lean is bad, and so you don't see it too often. But what you will see all the time is what I refer to as the compensated forward lean. And that is a forward lean that has all of the negative repercussions of the forward lean, but trying to compensate for it by pulling the shoulder blades back into what appears like a vertical posture, but it's not aligned because now you've got a really large arch in the lower back and tension in the upper back as you're walking. This also leads to an anterior pelvic tilt because the forward lean, by definition, has the pelvis tilted forward. Then we are just arching the back to appear vertical, but the pelvis is still tilting forward. You'll probably hear this from chiropractors all the time if you go to a chiropractor, that you may have a anterior pelvic tilt. Well, the question is, why do you have an anterior pelvic tilt? I believe it is a problem with function, not a problem with your body being born in a misaligned position. Form follows function. So if we walk like this, with this function, and then we compensate by pulling back with the upper shoulder blades, you're going to end up with a anterior tilted pelvis, enhanced or exaggerated lumbar lordosis, and all that's going to cause strain on the back, as well as the extra impact that occurs when you hit the ground with your heel. This can be corrected in the same manner as the forward lean correction, which is moving with rotation. Now, the challenge is, as I said, form follows function. If you walk in a certain way for long enough, you may get your body fused in the wrong posture. If you are stuck in this sort of anterior pelvic tilt posture, your connective tissues and joints may be stuck in that position because they've been in that position so long a period of time that it's difficult to get out of that. And that is going to take quite a bit of exercise and potential therapy to correct. The best way to do this is to begin walking correctly from the get-go and not end up with the problem of the incorrect posture to begin with. The next common walking mistake that I'm going to discuss is bouncing. Bouncing means we're not traveling in a smooth path as we're walking. Instead, we are moving up and down. The up and down is going to cause exaggerated impact on the joints, just like the forward lean does and just like the overstriding does. The bounce is probably not as frequent as some of the other walking mistakes that I'm describing in this video, but I do see people doing this, and I want to describe what's going on and how you can fix it. Here is what the bounce looks like. There's a pushing up with the body, and then a landing, and then a repetitive cycle of pushing up, landing, pushing up, landing, pushing up, landing. So what is the cause of the bounce? Let's look at it. When we walk normally, as I said, we are generally lifting off from this position with both feet on the ground. From this position, am going to activate my forward hip to swing through. And then we're going to repeat the cycle. With the bounce, what is happening, instead of lifting forward from this position, we're actually collecting all of the weight here as if we were going to try to run. And then we are pushing up with the glutes like this and then landing. And then we're changing weight to this position again and pushing up and landing. And so we're repeating this motion. The problem number one with this motion is that you're going to be landing with an excessive impact. But the more important issue with this motion is when you land, your weight is not going to be evenly distributed with your knee over your ankle. You're ending up landing with your knee towards the inside of your foot. That's going to collapse your arch over time and begin to wear out the insides of your knee joints. The next walking mistake I'm going to describe is the cross arm swing. If you're swinging your arms sideways, not only does this indicate some inefficient movement, but it also is going to be an indicator of problems that are going to trigger heavy heel impact and also misalignment of the joints. So, why would somebody walk with a cross arm swing? This is another compensation for trying to step forward from this position rather than from this position. Once you've reached this position, you can't lift forward like a normal leg swing. And there are only a few different ways to compensate for that to get the body to move forward from here. One of those is by twisting the entire torso. So instead of just turning forward on the left side, I'm going to turn forward on the left, and I'm going to pull my shoulder blades back on the right. So a full twist of the body. At the same time, I push off with my left hip, and that's going to create a slightly leaned forward movement with a heavy heel strike, and the twist is going to create the swing of the arms. So the twist of the upper torso during the initiation of the swing through is causing the arms to swing across the body instead of forward. Again, as usual, the correction is proper rotation of the core only forward. I only rotate forward. I don't try to rotate forward and back at the same time. And I need to move or generate the leg swing from this position, not from this position. The next walking mistake I'm going to describe, and one that you'll see in upwards of 20 or 30% of people out there, particularly if they're walking in flip-flops, is duck feet or out toeing, where the feet are going to be turned out when we walk. So this is going to be what out toeing looks like. And so the question is, why are people out toeing? Now, some people might think that, well, I was born with my feet turned out, and that's why I'm walking this way, so I can't fix it. But that may or may not be the case. but my feeling is that it is very likely that this has been caused by a functional issue. Most people that I see who are walking duck-footed are perfectly able to stand with their feet facing forward and their knees facing forward at the same time. If you can stand with your knees forward and your feet are forward, that means you don't have what we call external tibial torsion, meaning your tibia is turned out sideways while your knee is still facing forward. That would be a structural problem that becomes much more difficult to fix. But I believe this problem always starts with a functional problem of walking incorrectly. Now, if we do that long enough, the traction on the foot going outwards with every single step that we take over the course of years may indeed cause the tibia to start to turn out relative to the knee. And then you're going to end up with a structural, not only a functional problem. So it's very important to recognize this early and try to correct it. So why do people walk with duck feet? What's happening instead with duck feet is it's a misuse of our two core elements in the upper part of the waist and the lower part of the waist when we walk. Normally, when we walk forward, we are using the upper part of the waist to turn forward to place the foot down in a forward direction. And then I change weight, I swing through, I use the other side of the upper core to turn, place weight, change the weight using my lower abs, and then swing through. The movement begins with the upper part of the core turning forward, and that keeps me aligned in a forward direction of movement. But we're not always walking forward. A lot of times we have to turn. When we turn, instead of turning my upper torso forward and placing the heel down, I actually turn my lower abs, the lower torso, turns in the direction that we're going to move. So my lower abs on the right turn the body clockwise. So when I want to turn to the right, instead of placing the foot down in that manner, I actually place the foot down by turning the lower abs to the right, and then that's how I can generate a turn to the right. It's the lower ab, or that lower steering wheel, is turning the body out because I'm intending to move in a curve. But what happens if we initiate that curve with the lower abs and then change direction with the upper abs this way? We end up correcting or turning back into that forward position that we were facing and traveling in this manner, but we've already turned the foot outward. And then we continue to have the same issue with each step. I've turned, I use my lower abs here, and then the upper abs afterwards. And so what's happening is we have an incorrect sequence of movement. Instead of upper ab, lower ab, hip, upper ab, lower ab, hip, we have lower ab, upper ab, hip, lower ab, upper ab, hip. And we end up walking like this. I hope you've enjoyed this video. Make sure you've already clicked the like button before you sign off, and I'll see you in the next video. Thanks for watching.